It is written, "My people suffer because of lack of knowledge." This saying is as old as the human race on earth. Our progressiveness is at the risk of being slowed down as a lot of resources are allocated to alleviate the burden of disease, disability, and premature death among Kenyans. And yet most of the causes are preventable through health education and awareness in a well-needed health promotion initiative that includes maternal and child.
Nikafunzwa ukijifungulia hospitali ni bora juu kwa mfano wakati mama anapojifungua unaweza doa damu mingi na ukijifungulia hospitali wanaweza kusaidia.
Health promotion is a cornerstone of primary healthcare and a core function of public health. It is both health effective and cost effective in reducing the burden of disease and in mitigating the social and economic impacts brought about by diseases. An effective health promotion unit in the Ministry of Health has therefore been of necessity in recent time and now than before.
The foundation of health promotion, it started way back in around 1953 as Health Education and Audiovisual Aid Center. It has grown over the years to become the Division of Health Education and Audiovisual Aid after the devolved governments. The unit was changed from being a department to a unit. Now we are having the health promotion unit.
We did not have our policy documents and standard documents. We were actually struggling to get a foothold so that we put health promotion to where it's supposed to be and mainstream health promotion cross-board in all the health programs.
The APHIAplus Health Communication and Marketing, working in partnership with the Ministry of Health, seeks to promote access to and demand for quality health products, services, and information.
In 2012, we were awarded the HCM project by USAID. And one of the deliverables that we were supposed to do was to build the capacity of the Ministry of Health in terms of taking leadership or stewardship in health communication marketing initiatives.
We decided there are three things we are going to do. One, we are going to come up with policy guidelines to guide the health promotion function. The second thing we are going to do is train the health promotion officer, both in terms of technical skills and leadership skills. And then the third thing we did was set up this center of excellence, this idea that was only in our heads, but we needed to show people.
This project has seen the development of technical skills in all the 47 counties health promotion officers, and they have been trained on socio and behavior change communication. The project indeed succeeded in building the skills, which was one of the critical gaps.
We've been able to develop a 5-year health promotion strategy document, and we've been able to develop a health promotion guidelines that would now guide anybody who is new to the profession on really what is expected of them.
We now have a national structure that is well respected across the other divisions. We then have also county-specific stakeholder forums that have actually been created, and where within those stakeholder forums we are actually seeing all the players come around the table and help develop that.
So it is very important that each and every one of us are screened for both cervical cancer and breast cancer. Sawa sawa.
Tumefunzwa kuhusu tuwe tunajipima mpaka manyumbani.
The project goal is summarized as improved health outcomes for Kenyans through sustainable country-led programs and partnerships.
We have already formed a health promotion and advisory committee. The committee is comprised of a wide range of stakeholders. That includes the NGOs, the major health private sector, higher learning institutions, the religious groups.
These ones are an indicator of improvement, because even in our reports we are always asked about this and this. There is a massive uptake of delivery in the hospital, reduction in maternal death during childbirth.
We decided to develop specific messages targeting mothers at postnatal, and PSI was together with us. And we developed some flyers for that. We developed a fact sheet for the community.
We are working in close collaboration with partners such as APHIAplus, Western Kenya, AMREF, Odiara, Kanko, UNICEF, World Vision. And we are able to learn from one another. We are able to identify what weaknesses are there and what gaps we can fill as partners.
PS Kenya leads the APHIAplus HCM consortium, which is made up of other integral health partners, namely Government of Kenya, FHI 360, Gold Star Network, Changamka, Farm Access, and KMET.
In developing health communication campaigns, we have they go on TV, we have on radio, and we do the same. We replicate that message at mid-mass level, so you'll have road shows, market storms. We have one-on-one interaction with the key beneficiary, whom we call Sarah.
One of the frameworks that we have developed is the operational guideline that basically dictates or gives guidance on how the health promotion unit needs to operate. We also have the Health Promotion Strategy 2013-2016 that basically gives direction on what we need to do, how we need to do it, and when we need to do it. We're in the process of developing monitoring and evaluation indicators for health promotion, and basically this will standardize the way we do it, both at the national level and the county level.
The best way to go is actually have legislation that supports health promotion. That way, health promotion function will be funded for eternity.
One of the things that we have done and which was accepted by the county assembly was we put a big budget for community health, about 20 million. And with that community health, we are hoping to do a lot of health promotion.
Like at the national level, in the 47 counties, county health promotion officers are responsible for the planning, development, implementation, and evaluation of health promotion policies and projects.
My name is Junior Odiara. I'm the County Health Promotion Officer. Every Thursday, I go to Odiara FM to talk about health issues affecting our people.
We do have the ward administrators who are also very key in passing messages to the community in their daily or monthly or weekly barazas.
We went to public areas like churches, we talked with them. We printed IEC materials, which basically we disseminated everywhere. We posted in our WhatsApp groups to all facilities.
Through PS Kenya, we are able to have quarterly health promotion advisory committee meetings. And when we have some activities like Malezi Bora, the forum used to help us to bring all the partners on board so that we are able to solicit for funds.
In Kenya, among the young people, ignorance of risks and lack of knowledge of what constitutes high-risk behavior, pressure of lifestyles, and peer pressure are among the causes of diseases, among them sexually transmitted infections and unplanned pregnancies.
The number of pregnancies, of underage pregnancies, was very high. We had 6 pregnancies. We go to schools. We taught the girls how we can avoid getting pregnant, and now the number of pregnancies have gone down.
Watu wa APHIAplus walikuja katika shule yetu na kutufunza umuhimu wa kuosha mikono. Na umuhimu wa kuosha mikono ni kwamba tunazuia ugonjwa wa kipindupindu.
We had 20 schools which we visited, and from the hand washing practices which are in place, we see that cholera has not been in this county because of such efforts.
Maji inakuanga chafu. Huwezi tega maji ya mvua ufulie. Sasa ile inanyesha hapa unapata kinyesi imeanguka. Juu ya hiyo kukosa kutoka nje. Sasa hiyo inakubidi mtoto unashinda hospitali.
In Nairobi, at the informal settlements, the Ministry of Health and the Health Promotion Unit is working closely with the communities in a health-driven information and empowerment action to alleviate the burden of disease. And this is changing lives for the better, as people now know the need to always access clean, safe water and other practices like ensuring quality and hygienic sanitation in the slums. Women in 6 informal settlements around the city were involved in critical discussions on how to improve the living conditions of their families and neighbors, and that has improved their quality of life and freed more time for them to engage in other social and economic activities due to reduction in diseases.
Likuwa Maumba hii Miembeni hakuna choo hata kimoja. Choo ni msituni bwana. Lakini sasa alipoingia Bwana Beja kwa usafi wake alivyotuelimisha na tukasikia na tukajua tukachimba vyoo. Kulikuwa kuna magonjwa tofauti, kukawa magonjwa yale imetoka.
At least people in their households in those villages have access to latrines or toilets. We have increased from around 25, now we have over 42 villages.
For us to package and position the Health Promotion Unit as a center of excellence in health communication and marketing, we needed to model a center whereby anyone could access all that information. They could come and log in. So what we're looking for is some sort of depository and observatory, whereby everyone that is doing anything in communication can pull their materials and put it there, and anyone that is looking for any intelligence in health promotion can access both physically and virtually. So we ended up identifying a building at the Health Promotion Unit grounds, and we worked with some architects or interior designers, and we converted the whole place into a library, a conference center, and a place whereby people can access materials online.
Now with the Health Promotions Unit taking leadership both at the national and at the county level, we're able to see now consistency of messages tailored from the national level down to the county level. So I would say there's a lot that has come in just with regards to the last 3 years in terms of helping the Health Promotions Unit take leadership, lead the process, and drive the agenda of health promotions in Kenya.
Based on the excellent success of APHIAplus Health Communication and Marketing project, the lessons learned have been widely accepted and adopted as appropriate interventions against preventable diseases.
There is no way we will be able to achieve our Vision 2030 without embracing health promotion. You must empower communities to be able to take control of their own health and reduce out-of-pocket expenditure that they tend to incur because of always really having so many people falling sick.
There's a need for stakeholders, including the government, the donors, to push for more resources to be put in preventive and promotive health rather than curative health.